In Paris, Cook County is now at the lowest level of COVID-19 risk under new guidance set by the Centers for Disease Control and Prevention. This new framework looks beyond cases and test positivity to determine risk and instead focuses on hospitalizations and hospital capacity. Joining us now with their take are Dr. Susan Bleasdale, Medical Director of Infection Prevention and Control at UI Health, and Dr. Michael Bauer, Medical Director at Northwestern Medicine at Lake Forest Hospital. Thanks to you both for joining us. Dr. Bleasdale, what are the factors that the CDC is now using to determine the risk?
So the factors are not positivity alone, but also hospital capacity. And it's related to the staffed beds that have new admissions. And so it's really, I think, a more interactive, more reliable measure of what's happening in the community and what's putting a strain on the healthcare system. This is similar to what the Chicago Department of Public Health had put forth, is not just using those positivity and new cases, but what's the impact on our healthcare system that has that potential to impact not only patients who are ill with COVID, but the potential to impact patients that are ill with other issues that need care.
Why is the focus on hospitalizations the better metric to use versus case rates?
Well, because right now, thankfully, we have a large number of people that are vaccinated. And we have seen throughout this recent surge and the Omicron surge that people are still protected with vaccination and boosting. And so, you are someone that is young and healthy and vaccinated, it is unlikely that you're going to end up in the hospital. And so the numbers of positives that are overall going to do well, have mild illness, that alone isn't, I think, a factor that impacts how we need to put in mitigation measures. It really has to do with what's our strain on our healthcare system. And I think this new measures that the CDC has put in place is more meaningful in helping us to decide what mitigation strategies we need at different points. And it aligns with what we've done as a state and a city in saying that now masks can be optional for individuals in certain settings based on our transmission rate and our hospital capacities.
And Dr. Bauer, what about your hospital? Are you all still feeling the effects of this recent surge?
Yes, we're also feeling the effects, fortunately, of the precipitous decline. As little as 3 weeks ago, we had over 40 to 50 patients hospitalized with COVID. This morning, we were down to 8 hospitalizations. And I think what these new metrics really help reflect is the level of severity of the disease in the community, because we don't go through all these measures with other infectious outbreaks like flu seasons. So if we can see that the level of severity is now much less and not going to overburden the healthcare system and result in excessive hospitalizations, it's going to allow us to start to pull back on some of the measures like masking.
So to sort of illustrate what the CDC has done, we've got 2 maps to show you. One shows much of the country at high risk for COVID using CDC's old metrics. The other, under the updated system, much of the country is now at low to medium risk. Dr. Bleasdale, has the decrease in COVID, has it been as drastic as this change would seem? How should people look at this and look at this difference?
Well, I think there's 2 factors. There's this new measure, but I think there has been a dramatic decline in the number of patients hospitalized with COVID-19 in the last 2 weeks. Really, it's come down significantly. So I think that it is 2 factors. This new measure that I think is more, at least reflects more what we need to do from a mitigation strategy, and the fact that we have had a rapid decline from a peak in the first week of January.
Now, CDC has also endorsed universal masking in schools since July, but under this new guidance, recommending masking in schools only in counties at high risk. Dr. Bauer, what prompted this adjustment?
Again, now being able to say that areas are low or medium risk and deeming those to be relatively safe for the majority of people that aren't at risk, because most of our students in pediatric population are not at high risk. There are certainly some that may be, and obviously we want to encourage everyone to get vaccinated and boosted if eligible. But these new metrics allow us to say not only out in public, but even in school, where we know transmission by and large has not been a huge issue from student to student, it's going to allow us to get back to levels where we don't have to wear a mask. Of course, we want to make it a safe environment for students. And if anybody still feels like they want to mask, especially in these next few weeks as everybody adjusts to it, we want to certainly encourage anybody to do that safely for themselves.
Dr. Bauer, are you worried at all that these new guidelines could lead to another surge?
Yeah, I think there's the potential that we may see a bit of a bump, but I for one, am fairly optimistic that we're not going to see that at the current level. I think we need to be very vigilant come fall and next winter and be prepared to go back to layered mitigation, including masks, if we do see a new variant crop up or something else. But at the moment, I don't expect that we're going to see a big bump now.
And to that point, obviously this time last year, the vaccine had just rolled out. Everyone was excited about, sort of a relatively normal summer. And then Delta hit, Omicron shortly after that. Dr. Bleasdale, how concerned are you about a new variant cropping up soon?
Well, I think that there's a subvariant of the Omicron that we're watching closely, and there's a chance that we will see a new variant. But I think that it's important to highlight that Omicron's not gone, and COVID is not gone. And even now with these measures, it isn't no masks. It is masks are optional, and much of this now is a personal decision for many people in many settings about what's their personal risk, because there still may be COVID in the environment, and what is the community transmission. And this will help individuals decide about masking, and this will help us to prevent the next variant if we can keep control in some sense. And then this helps us on when we need to implement more significant mitigation measures as a community, as a school, as was highlighted already, or in a larger setting.
Okay, we'll have to leave it there. My thanks to Dr. Susan Bleasdale and Dr. Michael Bauer for joining us.
Thank you for having us.